Hi, everyone. Welcome. Thank you for making it today for my presentation on pre-nursing group advising. My name is Jeff Eng, and I am the Health and Medical Area of Study Advisor. I do ask that you save your questions until the very end. We'll have plenty of time to go over any questions you might have then. Right, let's jump right into it. So an overview of what we're going to talk about today. We're going to go over the various different pathways into nursing. Then we're going to go over some of the general prerequisites that you'll need to take and things to look out for when it comes to prerequisites. Then we're going to go into some specific information about the associate's degree in nursing or ADN pathway. And then we're going to go into some specifics about the Bachelor's of Science in Nursing or BSN pathway. And then finally, we're going to kind of compare which pathway, the associate's degree or Bachelor's of Science degree in nursing pathway might be right for you. So the nursing pathways include the associate's degree in nursing or abbreviated ADN, the Bachelor's of Science in Nursing, abbreviated BSN, RN to BSN, and nurse practitioner. For this presentation, we're going to primarily focus on the first two, the associate's degree and the bachelor's degree in nursing, and a little bit into the RN to BSN. If there are any questions about nurse practitioner, you can ask them at the end and I'll try my best to answer them. So here are some of the general nursing prerequisites to look out for. You will need to take English classes, which include English 101 and English 102, statistics, biology, which includes anatomy and physiology and microbiology, chemistry, nutrition, and psychology. A few things to keep in mind about prerequisites is that they do vary slightly from school to school, but most will include these classes here. Another thing to keep in mind is there may be a policy on retaking classes, and that can also vary from school to school. And finally, there may or may not be an expiration date on when you take some of these prerequisites. So to summarize, the prerequisites are mostly the same depending on the school you apply to, but they do vary slightly. The policy to retake classes can also be different, and there may be a expiration date on when you take those prerequisites. So the ADN program. We're mainly going to focus this slide on Seattle Central's associate's degree in nursing today, but a lot of the prerequisites that are mentioned here are going to be the same for other ADN programs, but today we're mostly focusing on Seattle Central's program. So at the top there, for students who are just interested in pursuing an associate's degree in nursing, the most common degree that they would be coded for here at North would be the Allied Health AAST degree. So kind of a brief overview of the college. Seattle Colleges is part of a district, which includes North Seattle, Seattle Central, and South Seattle College. And in the past, the nursing program, each campus had their own separate nursing program, but now that has all been consolidated into one school. So the nursing program is now managed through Seattle Central College. So what does that mean? It means that when you're ready to apply, there's one application that you're submitting, and that is through Seattle Central. So you would first have to apply to Seattle Central like you applied at North. You would have to submit an application to Seattle Central, And on that application, you'll have the option to choose which school that you want to take your nursing classes at. So if you prefer to do your nursing classes at North, you would put North Seattle College as your top choice on that application. So one application, 3 cohorts. Cohort meaning that each campus has its own separate nursing program starting at the same time. So some of the prerequisites that you'll need to take are English 101, Bio 160, Bio 241, Bio 242, Bio 260, Chem 121, Math 146, Psych 100, and Psych 200. Some of the co-requisite classes that you'll need to take include English 102, Humanities 105, and an ethics class. So the difference between a prerequisite and a co-requisite is that prerequisites are classes that you have to take before you can apply, before you're eligible to apply into the program. Co-requisite requirements, on the other hand, are classes that you have to take before you can graduate with your associate's degree in nursing. So for your co-requisites, you can choose either to take them before you start or during the program alongside your nursing classes. And then a note about Nutrition 101. Nutrition 101 is required, but it is included in the curriculum in the first quarter of the ADN program at Central. So you can either choose to take Nutrition 101 before, or you can save it until you're admitted into the program. So those are the classes. In addition, you also need to get your CNA license, Certified Nursing Assistant. And you can do that through the Nursing Assistant Certified program through Seattle Central. I do encourage you, if you have more specific questions about the NAC, the Nursing Assistant Certified, to attend an info session at Seattle Central. They do offer them pretty regularly. And the last requirement is the TEAS test, which is a test that you can take online. In terms of admissions, the program at Central admits for fall and winter quarter. The deadline to apply for fall quarter is in April, and the deadline to apply for winter is in September. So the application opens up at the beginning and closes at the end of each month. So the beginning of April and it will close at the end of April for fall quarter, and it will open up in September. Beginning of September, closes at the end of September for winter quarter. Admissions is a lottery-based system, meaning that as long as you meet the minimum 2.5 GPA for all your prerequisites, and you've got your CNA license and passed your TEAS test, you have this equal opportunity getting in as any other student. RN to BSN. So once you get your associate's degree in nursing and pass your NCLEX and get your RN license, you can start working as an RN right away. However, for the most job opportunity, most nurses will go back to school and enroll in what's called an RN to BSN program. And that program, it's not offered through Seattle Central, but there are a couple of options in the area, which include UW-Bothell, UW-Tacoma, Bellevue College, Olympic College, and there are various other online programs to choose from too. And then for the BSN route, the most common degree that students would be pursuing here at North would be either the Associates of Art or the Associates of Science degree. The prerequisites include English 101, English 102, Chem 121, Chem 131, Bio 241, Bio 242, Bio 260, Psych 200, and Math 146. Also requires an additional college level math class and Nutrition 101. Admissions, typically, they only admit once a year, and that's for fall. And it is not a lottery-based system, which means that your GPA matters more than if you're applying to Seattle Central's ADN program. I do strongly recommend if you are considering a BSN program to attend a BSN specific information session at the school that you are interested in. So if you're interested at UW or Seattle University or Bellevue College even has a BSN program, I would recommend going to one of those information sessions for more specific information.
Hey, sorry, does the BSN pathway, does that also require the CNA certificate?
That's a good question. It does not require the CNA typically.
Okay,
Mhm.
thank you.
Good question.
Also the TEAS test. And what is the full form for TEAS test?
I'm sorry, the TEAS test?
Yes.
What about the TEAS test?
Is it required in BSN? And also, what is the full form?
It's not a requirement for the BSN usually, the TEAS test.
Okay.
There may be a separate test that you need to take. For example, UW, there is a test once you are admitted or before you're admitted that you have to take. But if there's those are the specific things that I don't have as much information on. So that's where the information session, the BSN specific information sessions would be good for you to go to.
Okay.
Good questions. Moving on, what pathway is right for you? So how do you choose? So if you're looking at the ADN route, some advantages include you only have to focus on taking the necessary prerequisite classes before jumping right into taking your nursing classes and getting your RN license. If you're looking at applying to Seattle Central specifically, it is a lottery-based system. So that means that it is a little bit less competitive. And our program admits twice a year. Things to consider though, when getting with this pathway is that job opportunities are greater if you have your BSN, but your employers do encourage you to go back to school to get your BSN. So you do have that option to work and take classes to get your BSN by enrolling in a RN to BSN program. In terms of timeline, depending on if you're taking classes part-time or full-time, it will take roughly 1 to 2 years to complete your nursing prereqs. And then another 2 years in the nursing program, taking your nursing classes before getting your associate's degree in nursing, which will make you qualify to sit for the NCLEX to get your RN license. And then after you have your RN license, you can start working and take classes, and it will take another 3 to 4 quarters to get your Bachelor's of Science in Nursing. And then if you go directly into a Bachelor's of Science in Nursing, advantages include you don't have to worry about doing that extra step of getting your BSN by enrolling in an RN to BSN program. And there are greater job opportunities right after graduation with a BSN. Things to consider though, BSN programs are more competitive. So your GPA matters more than if you're applying for an associate's degree in nursing. And these programs typically only admit once a year, and that's in the fall. In addition to taking the necessary prerequisite classes, you do also need to take general education classes, so like arts, humanities, as part of your either your Associates of Art or your Associates of Science degree. So those are classes that are unrelated to nursing that are requirements to get your transfer degree in order to be able to apply into a BSN program. The 2 years here, it's assuming that you're taking classes full-time. So it might take closer to 3 years if you're taking classes part-time, if you want to complete your Associates of Art or Associates of Science degree. And then another 2 years in the nursing program to then get your Bachelor's of Science in Nursing. And then there is a third option. You can try pursuing both and the ADN and BSN at the same time if you want to maximize your chance of getting in somewhere. So that's all I have for you today. I'm gonna go ahead and end this recording.